All right, well, welcome to our next installment of the Whole Body Migraine Assessment. So, I'm Dr. P, otherwise known as Dr. Tanya Paynter. Conventional approaches to migraines are just really kind of a guessing game at best, right? And it's really unfortunate because we do know a lot about the research behind migraines and things that are triggering them, but the problem is that it just takes a little investigating to figure out what those things are. And unfortunately, the conventional approach really doesn't do that. It doesn't really dive deeply into kind of your symptoms and the patterns that emerge from you kind of as a whole person. So really, to understand what's happening in a migraine, we want to kind of look at the whole picture, right? The whole body, all the symptoms, migraine related, non-migraine related. So in this whole body migraine assessment, I like to review the information that is shared by the person who signed up, evaluate what I'm kind of hearing, the picture that I'm hearing develop as to some of those underlying symptoms or those underlying patterns that their symptoms are revealing. And then that will help to kind of guide where that person should focus their migraine treatment to actually see improvement in their symptoms. So with that being said, let's kind of dive into today. So today we have Camille. So Camille is, she shared the following information. So she has noticed that stress is a trigger for her, usually after stress has passed. So she'll be triggered on the first day of her vacation or after a big event happens. She notices that they start midday mostly, but she'll wake up and kind of know one is coming. They started getting daily after about 6 months after her second child was born. And she notices that she gets worsening migraines 2 days before her period. She has them about 20 days a month plus. She has to take daily allergy meds. Otherwise, then she'll get sinus infections. And she has a pretty strong family history of migraines, depression, some other things there as well. So that is, thank you for sharing all that, Camille. That's some really great information. And there's some really big things that are kind of standing out for me. So number one is you kind of hit the nail on the head. You mentioned that you mentioned that stress relief is really what kind of triggers you. And so that's a very common pattern. So we know that cortisol, which is our stress hormone, when it drops, we know that triggers a migraine. And so for you, when you're under stress, you feel fine. You probably feel energetic and pretty good and upbeat and, ready to go is my guess. And then as soon as that stress has been removed, and I'm talking about, like a big event, if it's just chronic everyday work stress, that's a little bit different. But if you kind of make it through your big stressful, like 1 or 2 day event, and then you crash hard the day after everything is done, that is a very, very typical picture of cortisol dysfunction, cortisol drop. Midday is, so again, looking at cortisol in a day-to-day picture, cortisol will spike in the morning and then will drop significantly around 11 noonish and then kind of coast in until nighttime. So again, anytime we're looking at a cortisol deficiency, when I hear kind of midday, noonish, maybe around lunchtime that you start feeling like your migraine is hitting, that's typically, and for people who already have some lower cortisol levels going on, you don't peak quite as high and you drop earlier. So it sounds to me like that midday drop, that, noonish, maybe it might even be as early as 10 or 11 for you. That is, going to be kind of what is triggering those mid-afternoon drops in most cases. So for that piece, I would really strongly encourage you to have some salivary adrenal testing done if you can. If you can't, if you talk to your doctor and your doctor says, I don't know anything about that, but we can order a cortisol test. Usually they'll want to do a blood test, and I can almost guarantee you first morning blood cortisol level will be normal for you. So what we need is at least a 24-hour urinary collection, and you might not be outside of the normal cortisol range, but if you're on the the 25th percentile on the low end, within that 25th percentile, that's going to be positive for a cortisol dysfunction for you. So that's one piece. The other piece, which is very very closely related to cortisol drops and cortisol deficiency, is hormone, specifically progesterone. So hormones they share a common pathway with cortisol. So when we say cortisol deficiency being a key piece, we usually also hear progesterone, estrogen issues going on as well. So you noted that it was worse after the birth of your second child, about 6 months. So the interesting thing about pregnancy and migraines, I hear this very often and it makes complete sense. Number one, progesterone is high when we're pregnant to keep the pregnancy viable, right? And so, to our bodies, our bodies love progesterone. It makes us feel calm and happy and relaxed. And it's it's a neurosteroid. So it's anti-inflammatory for our brain. We sleep well. Well, maybe not if you're 9 months pregnant, but still, you know what I'm saying? And then when it drops after we have our kiddos, then, of course we have that, 3 to 6 month kind of fluctuation as we're breastfeeding and hormones are kind of adjusting and things. And that's a typical time when I start seeing kind of that hormonal worsening migraine picture happening. And then on top of that, throw in, you have a new baby. So, you're back to work, you're not sleeping through the night in most cases because the baby usually doesn't. And you've got all this other extra stuff that you have to do. And after, 4, 5, 6 months of this, your body is just like, oh, I can't do this anymore. And your cortisol is depleted, your progesterone is dropped. And so then unless you're actively aware of this and working to prevent that from happening, we tend to see that things just kind of compound as you move forward in life. And the things that can continue to stay bad and or get worse because we get even less resilient as we get older. And so then our deficiency kind of compounds itself. So I very strongly suspect for you, you've got a functional progesterone deficiency, if not outright frank progesterone deficiency. So in addition to doing the salivary cortisol testing, I would encourage you to do some salivary hormone testing to kind of take a look at what the functional levels of your hormones are doing as well. One thing that's really important to note for hormone stuff is you can actually be tested. And I've mentioned this before several times in various videos. So you can look a little bit further. So I'm just going to mention it briefly here, but when we're talking about estrogen, progesterone, the balance and the ratio between the two, super, super important. So you might come back normal estrogen and normal progesterone, but if you're low normal progesterone and high normal estrogen, that imbalance can play a big role. And so your body sees that as a progesterone deficiency, even if you're within normal range. So that's really important to notice. And that salivary hormone testing, there's several different places that test that can do it. Labrix through Doctor's Data is one, Dutch testing through Precision Analytics, I believe, is another. And those both provide you with progesterone to estrogen ratio. We want it to be 200 to 1 or better. And typically what I see is that it's like 20 to 1 or 50 to 1. So that's a functional progesterone deficiency. And then just a couple other brief things that I'll mention quickly. The daily allergy meds, there's something funky going on there. I'm sure that you've probably already been worked up if you know that that's a problem. But if you're taking something like Flonase, doing the nasal sprays every day, that actually contributes to cranial hypertension. So that can actually increase your blood pressure in your brain. And then as you withdraw from it, that kind of causes that rebound vasodilation. The same idea as behind caffeine rebound headaches or medication rebound headaches. Flonase and things like that can cause that too. So if that's a part of your picture, then that's going to be a problem from a migraine standpoint. And kind of taking a look at what's going on from the sinus infection piece is going to be important because we have to get you off of the daily allergy medication to see that good improvement there. And then family history, I'll just mention a couple of genes that are likely relating to kind of that family picture. And these are things, there's, well-documented links between these genes and a correlation with migraines, especially migraines that run in families. And there's a bunch of information. There's mthfr.net and something called Dirty Genes is a book by Dr. Ben Lynch. He's amazing. He's another ND who really focuses in on some of the genetics. But that's where you can get some more information on COMT gene, COMT gene, MAOA gene, and DAO gene. Those are 3 that kind of possibly stood out for me, for you as well. So those are things that you can look at and do a little bit of digging into and see if there's some stuff that you can do to help support how those genes work for you. That's going to be a little bit lower on the list. I think the hormone cortisol piece is absolutely #1 issue to work on. And then the last thing that I noticed, you had a little, let me see if I can find what you specifically said. I find this interesting. Have you found certain foods trigger a migraine? If so, what foods? And you say, nope, but I don't have a migraine. If I don't have a migraine, I don't crave chocolate. So that gives me a couple of like some clues there. There's two main things that chocolate, like that we crave chocolate for. One can be that stimulating caffeine effect. And you did notice that caffeine makes your migraines better. So that piece right there tells me that there's a vasodilation piece to it, right? So we want to do things that are going to help to cause that that vasoconstriction to happen. And so, you know, going low arginine can be helpful with that. Taking a look at nitric oxide production so that your NOS3 gene can be helpful. And then doing some things, you know, tracking blood pressure and seeing, okay, does my blood pressure spike when I have a migraine or does it drop? A lot of times I actually see it dropping. It should be spiking. When we're in pain, our body's natural response is to spike blood pressure, but I actually see the opposite happening. And that tells me that there's an inappropriate response, and vasodilation is an issue for people with low or drops in blood pressure that can trigger their migraine. So that's a really important thing to kind of hone in on. So it'd be good for you to track your blood pressure normally, and then also during a migraine and see what you notice there. And then the other thing that people really crave chocolate for is magnesium deficiency. So chocolate is higher in magnesium. So that's something just to kind of have in the back of your mind that perhaps there's a magnesium piece going on as well. However, something to just be aware of, I'll throw this last little tidbit out because I'm sure that you're frantically scribbling with all of these things that I just shared. But magnesium does contribute to vasodilation. So it can, you might notice that in some cases people respond to magnesium with a migraine. And so then that keeps them away from magnesium, which is problematic because magnesium deficiency is linked to migraine, right? So in order to kind of help counteract that, magnesium with calcium. So calcium helps with vasoconstriction because it helps to contract the muscles around the blood vessels, whereas magnesium helps to relax the muscles around the blood vessels. So if you take calcium with the magnesium, that actually will help battle that. And a lot of times people will tolerate that combo when they won't tolerate magnesium alone. So just a little tidbit if you find that magnesium does actually trigger something for you. So that was jam-packed with information. Hopefully that wasn't too overwhelming, but the good thing is it's a video, you can replay it and take as many notes as you need to. But by and large, the biggest thing to focus on, Camille, for you is going to be the hormone and adrenal evaluation, and then kind of treating what you find there. That's going to be number one. So hopefully for everybody else who's watching, that was also helpful. I want to kind of end our session here today by just mentioning a couple things. It's really important to evaluate you as a whole person and as an individual, right? We know a lot about migraines in general, but for you specifically, you're going to have a different picture than Camille. So we want to, make sure that you're being evaluated properly. And then we want to work on trying to eliminate those triggers and, the things that are going to be contributing to your migraine picture. But the third piece that's super important is the alleviation, the healing piece. It's not just treating the symptoms, because then that's just kind of, using supplements as medications, right? We want to actually heal you. And so that's the important third step. So we really want to target those underlying pathways and get them to where they need to be, as opposed to trying to just take supplements that are going to hopefully help to kind of cover up that issue. So a lot of people kind of get that confused and they turn to supplements because they're not as side effect prone as medications can be, and people feel safer with them. And that's great in the short term, but that's not a long-term solution. So really making sure that when you identify those underlying issues, that you're actually working with somebody to bring that healing about, so that you no longer have to take those supplements regularly, or you no longer have to avoid all the trigger foods, right? You should be able to add foods back into your diet. So this approach can be amazingly effective. It's how I got myself out of chronic migraines. It's how my hormone and my nutrition coach got herself out of chronic daily migraines, and how our clients are able to get out of their daily migraines as well. So if you want more information about this type of individualized kind of biochemical approach to your migraines, then I invite you to watch my free training. It's linked below in the description. And you can also visit us at migrainemastery.org. There's a bunch of different resources there for you as well. And I hope you found this helpful.